So I once again welcome all of you who have joined us today into this very healthy seminar, because we are going to talk on health here today, and that too my talk will be on to how to become pain-free. I use different modalities in our clinic, like already Rashmi ji said that we are using sujok therapy, magnet therapy, color therapy, etc. But today I am going to speak on acupuncture and acupressure. Through acupuncture and acupressure, how we can get relief from pain. The basic idea is that we should know some basic pain relieving point. So at any point of time, if you feel pain, instead of galloping a painkiller, first try this points at home by yourself. So when you are doing this point by yourself at your home, you can use acupressure, because acupuncture is a very a field where you need to be very expert of this. It needs a master and you have to be skillful to use acupuncture. But the points of acupuncture and acupressure both are same. So the difference is between the modality. When on that specific point, if you are doing pressure, it is called as acupressure, and if on that point you put a needle, it is called as acupuncture. And believe me, acupuncture is also very effective and totally painless. People think that putting needles into the body will give pain, but the needles are so thin that I will assure you that you have no pain when you are taking acupuncture treatment at an acupuncture clinic. So today, whatever points I will show you, you can do it. You can do pressure on that. And the modalities that I said, that seed therapy or color therapy, can also be combined on the same points. The points will remain same. The modality can be different. So I would like to share my screen for my presentation today. And I request everyone to take a comfortable seat so that you can have this presentation for half an hour. So please adjust, take your water bottle with you so that you don't have to move when you are seeing this presentation. So let's start with the screen sharing. So I'm Professor Dr. Reshma Suryavanshi. Professor Dr. Reshma Suryavanshi, because I have done my PhD from Open International University of Sri Lanka into alternative medicine. And I'm doing my second PhD with the biggest university, that is the Banaras Hindu University, Varanasi, on role of yoga in women, health and physics. So I'm Professor Dr. Reshma Suryavanshi. And we are talking about acupressure and acupuncture, and how acupuncture and acupressure can help us relieve pain. My aim is to create a pain-free society, and that's the reason today I have come with this topic, that is the pain relief. So if there is, because if you're seeing to any home, at least if there are 5 people, 3 might have some or the other pain, either headache or stomach ache or leg pain. So this is a very important topic which has to be catered, and maximum amount of the medicine that we are developing is because of the pain. Hence, when I get a time to speak on this topic, I definitely like to speak on pain management. I want to make one thing clear here, that I am not in oppose of the medical science, or I am not in oppose of the allopathy, but only where you can avoid this extra galloping of the painkillers is what I want to make a point here, that yes, definitely you can minimize the use of these painkillers. So coming back to our topic, acupressure, you can see on the screen. Are you able to see the my screen? Can you see the?
Yes, Reshma ji. Yes, Reshma ji.
Great.
Thank you.
So acupressure is the application of pressure on parts of the body in a therapeutic way to relieve pain or reduce muscular tension. So you can relieve pain, and even you can reduce the muscular tension. Not only muscular tension, but also you can cater different types of diseases into acupuncture and acupressure. But because today we are taking the topic of pain, and generally when you are doing at home, then you can relieve pain and reduce the muscular tension. Otherwise, if you're going to a registered acupuncturist or a registered acupressurist, they can even relieve your pain if it is a joint pain or it is an pain related to the bones also. Definitely you are going to get very good results, and whatever point we are going to see today will definitely help you in any kind of the pain. And then once you can take those points at home, and then you can definitely, if you require, you can go to an acupressurist or an acupuncturist or an allopathic practitioner as per your requirement. The principle behind the use of the acupressure treatment is to increase the circulation and function of chi. So everyone, to increase the circulation of and functioning of chi. So what is chi? Chi is basically it is called differently into different civilization. Like in our Indian civilization, we know chi as prana. So it is believed, and it is true as well, that as long as the prana remains into our body, our lungs are functioning, our hearts are functioning, our kidneys are functioning. So there is our body is also made up of prana, and it is also called as ki in China. It is called as chi in Korea. So in different language it is called differently. So you can understand, Indian people can understand it as in prana. So the basic principle of acupressure treatment is to increase the circulation and the function of the prana. So if we can increase, if we can stimulate the circulation and the function of the chi, many type, not only pain, but a long list has been given by WHO, which can influence positively into many diseases. So of course, pain can also be catered by the circulation and the functioning of the chi. Second is prevention and as a treatment of many health conditions. So very important here, I want you to again read this line on my screen, that acupuncture and acupressure is not only for a ill person, it is for prevention also. So as it is not like that if you are ill only you can take this therapy, to remain healthy also. Because when you are taking an acupressure treatment or an acupuncture treatment, your full body is getting energized, because we are working on to the prana, the chi. Also, it influences your blood circulation. So, and it is also influencing on your immunity. So your immunity boosting is also done very nicely by acupuncture and acupressure treatment. And in this last 2 years of COVID, we have been giving lot of lectures on how to increase the immunity with acupuncture and acupressure. So definitely it has acupressure has a very wide field, and its role and its importance is very large. So not only for pain, but all kind of like immunity disorders also, you can have acupuncture and acupressure. So it is prevention, and as a treatment of many health conditions, you can use acupressure and acupuncture. It reduces stress. See, whenever we are talking to anybody nowadays, stress has become very common thing, and each and every one, I said, if we go to a family of 5 people and 3 people are suffering from pain, but if you go in a family of 5 person, all the 5 person will have some or the other kind of the stress, because we in today's fast life, we have some real stress and some perceived stress also. So reducing stress is also very important, and acupuncture does reduces stress also. We have very wonderful points into acupuncture and acupressure. So when people come just for a rejuvenation session, those people who are not ill, those who are not patient, but just they want to take this treatment as a prevention and rejuvenate themselves, of course, we are definitely catering them onto the stress also. And acupressure points work very well to combat any kind of stress. So already I spoke that acupressure stimulates the immune system, and it really fights out any kind of problem related to the immune system. And in this COVID times, it has been like all the acupuncture acupressure points have been like a blessings to thousands of people. And we have been propagating these points, and we have made charts of these points also, which stimulates the immune system. So you can do it at home, or you can go to an acupuncturist locally in your area and definitely take treatment for immunity system if you feel, or if you are diagnosed with a low immunity system. It improves circulation. So all kind of circulation are improved by acupuncture or acupressure treatment. As we already spoke, that it improves the circulation of the prana, the chi. It also improves the circulation of the food that you are taking. It improves the circulation of the blood into the body. It improves all kind of the circulation into your body. So it's very, very good to have acupuncture or acupressure treatment if you are ill, or you are into a sub-healthy state, or you just want to get a rejuvenation. So acupressure is used for treating a variety of disorders that I already spoke. It stimulates a healthy digestive function. Most of the metabolic disorder nowadays are there, and the main root cause is we are not having that healthy digestive function. So acupuncture and acupressure treatment, it also stimulates healthy digestive function. It soothes out chronic pain, right? So acupuncture, acupressure works for acute pain also and chronic pain also. See, past, if I already am into this field from past 20 years. So if I talk 15 years back, that at that time, people used to think that only for chronic pain only we can come for acupuncture, acupressure. But now there have been a very good awareness of these therapies. And at the first place of the treatment, even into acute pain also, patient come to us. So instead of developing a pain, now a painkiller, they know that they can go for this therapy into acute pain also. So definitely it soothes out chronic pain, and also very, very effective into acute pain also. And I would like to make a point over here that acute pain, to reduce the pain of the acute pain, basically it takes hardly 30 seconds for an acupuncturist. So it is more faster than the pills that we develop, because it will take 10 minutes at least. When you will take water, you will take pill, then it will dissolve into your blood, and then you will have that effect of reducing pain. But here, when we do acupuncture and acupressure, acute pain can be we can reduce that within a span of 20 to 30 seconds also. It improves energy level and concentration. Definitely acupuncture, acupressure improves energy levels, and it also improves concentration. So if someone looking for good concentration, definitely can go for an acupuncture or acupressure treatment. Techniques used. There are a variety of techniques used into acupuncture and acupressure. Acupressure technique involves, we are talking about the acupressure technique over here. Acupressure techniques involves pressure application, rubbing, stretching, rolling, kneading, wiping, grasping, and exercises. Sometimes we can have and practical sessions here. All the audience, those who are interested into having this practical sessions and want to have how to do acupressure, how to apply this application, like how to rub a point, how to do stretching or rolling, can definitely send their messages to us, and we can have a workshop for all of you. Those who are interested, and all of you can learn this acupressure techniques as well, how to do stretching on the points, how to do rolling, how to do rubbing, how to do kneading. And believe me, do go for an acupuncture or acupressure center near your place. Definitely it's going to rejuvenate you, and you will fall in love with this therapy. But also, this is not going to make a habit, so don't worry, it's not going to convert into a habit, but definitely it will rejuvenate you. Intensity of pressure varies whenever we are doing pressure at a point. So depending upon the anatomical location of the point, the intensity of the pressure will vary. Also, the intensity of pressure will vary onto different factors also, whether we are seeing the age of the person, the skin of the person. Also, the intensity of the pressure varies from person to person. Different approaches are there for applying pressure. you can have a constant pressure, you can have an intermittent pressure, right? So these are different approach of the pressure. Sometimes you have to give constant pressure, sometimes intermittent pressure. So into chronic, it divides into what type of pressure you give into acute disorder, and there is a different type of pressure when you give into the chronic disorder. So it's like that. So you have different type of pressure, that is constant, intermittent. Now the benefits of this therapy. Already we are talking about so much benefit, and by now I hope that all of you have been fallen into the love of this therapy, acupuncture and acupressure. And you should, if you want to remain young, if you want to look young for a longer period of time, yes, acupuncture, acupressure does that too. It gives a very good cosmetic effect also. Not only being healthy from inner, you look healthy from out also. So there are lot of benefits of acupuncture, acupressure treatment. It works to set the whole body in balance so that it is work to function better as a whole. Whenever we are doing an acupressure or an acupuncture treatment, it's a holistic treatment. So it is going to cater your each and every body organ, your each and every body system, your endocrine gland, right? So it's a holistic module of treatment. Regular treatment results into improvement in overall physical and mental health. So whenever we are going for acupuncture or acupressure treatment, the added benefit is the patient come for the physical improvement, but along with physical improvement, you are getting mental health for free. So nothing better than that, right? Unlike acupuncture, which requires a visit to a professional, acupressure can be performed by a lay person, right? So I already spoke during the first phase of my orientation that acupuncture definitely needs a professional person only. So acupuncture you cannot do at home. You will have to go to a professional, but acupressure can be performed by anyone. So whatever point we are going to see today, all of you can definitely take the benefit of that, and you can do acupressure on these points. Acupressure techniques are fairly easy to learn and have been used to provide quick, cost-free and effective relief from many symptoms. So it is very, when you are doing acupressure by yourself, definitely it is cost-proof, and it is also giving, I already said, it gives very, quick results also. The results are also quick, and it is fairly easy to learn. So it's really, if somebody want to learn this and master these therapies, so acupressure is very, easy to learn and master. So if any one of you are interested in learning this therapies, definitely you should learn these therapies, because it is easy to learn, cost effective also, and giving very, quick results. A recent study published into the British Medical Journal has shown that acupressure is effective for treating back pain in terms of reducing disability and pain scores and increasing functional status. So it not only reduces pain, but it is also reducing the disability, and it is also increasing the functional status. The study, which compared acupressure and physical therapy, showed that all acupressure was more effective. Overall, acupressure was more effective in these areas, both immediately after the treatment and at the 6-month follow-up. On the screen, you can see different type of acupressure instruments that are being used to give pressure. So if you don't have any instrument, you can use your finger or your thumb to give pressure. And all these acupressure instruments that you can see on the screen are also easily available into the market. So this, you can see this instrument, this probe, which is called as Jimmy in Indian market. So this probe with you give acupressure, you give pressure to the points. This probe is called as Jimmy in Indian market, right? So this is acupressure probe. Then you have this acupressure roller. Then you have this acupressure foot mat. So even acupressure and acupuncture are also subdivided into different different subjects. So we have subject in acupuncture, acupressure like reflexology. So reflexology, if you see, your whole body points are into your foot and palm. So if you can see on the screen, this acupressure foot mat. So when you're walking onto this acupressure foot mat, your all points are getting stimulated. So when all these points get stimulated, walking onto this acupressure foot mat, then your whole body gets rejuvenated. And that is the reason when you go to temples, you will find that there is a pathway of pebbles being made there. Because when you are walking onto this pathway of pebbles, your acupressure points are being stimulated, and when the acupressure points get stimulated, you feel good. So even at your home also, you can have a pathway of some pebbles which are not very sharp to stimulate all the points of your full body. So these are different type of instruments that you can that can be used. Sorry. Yeah. So that was about acupressure, and let us talk about acupuncture as well before going to the basic points. Acupuncture is a method of relieving pain or curing illness by placing needle into a person's skin at a particular point on the body. So the points of acupuncture and acupressure remain same, because the theory we are talking about is the traditional Chinese medicine, the points onto the meridian. So the meridian points will not change. Only while doing acupuncture or acupressure, the difference is only between the modality. So in acupuncture, we are placing needles in the person's skin. Acupuncture is used mainly to relieve discomfort associated with variety of disease and condition. Acupuncture is known to treat a wide range of disorders. Technique uses the most common method used to stimulate acupoint is the insertion of fine sterile needles into the skin. So you have to be very, very cautious, because the needles that are used are sterilized needles. So an acupuncturist, a licensed acupuncturist will always use a sterilized needle only into your skin. So there are no chances of any side effects. Pressure, heat, or electric stimulation may further enhance the effect. After putting the needles, we put electric stimulation onto the needles also. So or we can do a heat treatment after putting needles. That is moxibustion. We call that technique as moxibustion. It is a herb through which we are giving heat onto the acupuncture needles, and that point is heated to get the therapeutic effect. Other acupoint stimulation techniques include manual massage, moxibustion, heat therapy, cupping, and application of topical herbal medicine. So topical herbal medicines also, we insert the needle into the topical herbal medicines and then we put into the patient's body. And also you must have seen cupping. Cupping is becoming very familiar nowadays. You can see cupping marks onto the athlete's back also. Sometimes you can see those cupping marks. So cupping is also a part of acupuncture and acupressure treatment, giving very, very good results into muscular disorders. It is very, very helpful. It's very helpful to reduce pain also. So these are different types of techniques that are used into acupuncture. So how small is the acupuncture needle? This is how small it is, and it's definitely not going to hurt you if you are going for an acupuncture treatment. The treatment process is also very simple. The initial evaluation may take up to 60 minutes. Subsequent appointments usually take about half an hour, because I already spoke that it is a holistic module of treatment. So the initial evaluation may take time because we are working onto the whole body, not a specific disease. Though we are concentrating onto a disease, but we are treating the person as a whole, right? So it takes time for the initial evaluation. A common treatment plan for a single complaint would be typically involve 1 or 2 treatments a week. And number of treatments will depend on the condition being treated and its severity, but 6 to 8 treatments are common. For complex or long-standing chronic condition, 1 or 2 treatments per week for several months may be recommended. For acute problems, usually fewer visits are required, usually 8 to 10 visits in total. So condition commonly treated successfully treats condition like musculoskeletal problems, so back pain, neck pain, others can be treated by acupuncture and acupressure treatment. Nausea can also be treated, migraine, headache, anxiety, depression, insomnia, infertility. Infertility also, we have very, very good results of our clinic into infertility. We have almost 90% result into infertility cases Yes, acupuncture does give very, very good results to infertility also. We have done patients who without IU and IVF, and also those patients who were into IU and IVF treatment also. So definitely for stress, anxiety, depression, you can go for an acupuncture treatment, as well as for infertility also. It is giving very, very good results. Benefits are it provides drug-free, pain-free relief. So you're not having any drug, and you get pain relief. Effectively treats a wide range of acute and chronic ailments. Treats the underlying cause of disease and illness as well as symptoms. This is very important, that we are not only treating the symptoms. Whenever we are doing an acupuncture or an acupressure treatment, it treats the underlying cause of the disease, right? So when we are treating the underlying cause of the disease, naturally the symptoms are also going to vanish, but basically it concentrates on treating the underlying cause of the disease. Assisting to prevention against disease and illness, as well as maintain general well-being. Studies have found promising result of the use of acupuncture to treat nausea and vomiting related to pregnancy, chemotherapy, and post-surgery pain. So even patient going for chemotherapy can take a complementary treatment of acupuncture, acupressure, and it also reduces the session of the chemotherapy that were earlier advised by the doctor, and they can easily overcome all the side effects of chemo also. So simultaneously you can take a acupuncture, acupressure treatment and go for the chemotherapy. And post-surgery pain also, acupuncture is very, very effective. These are some of the risks, because each and every therapy has some risks involved with it. So these are some risks. That is, when you are taking an acupuncture treatment, there can be a soreness on the point where you have put the needle, but it can go within 10 minutes to 2 hours. That soreness will go by itself. There can be a minor bleeding or bruising at the needle site. So it can be a minor bleeding. So it's okay to, if you bleed a little after acupuncture treatment, the toxic blood is getting out from there. So nothing to worry. If it is a minor bruise is there, you can just go home and do ice application if there is a bruising on the needle site. Organ injury is one of the risks into acupuncture treatment only if the acupuncturist is not using the standard size of the needle. Like if you want to do puncture somewhere just behind the lung, and if you are using a very big needle, only then there can be pneumothorax. Otherwise, there is no organ injury. Only if the therapist negligence can only happen there. Into my 20 years of practice of acupuncture, I have not seen any of the patient having any organ injury, right? And there are very, very small chances of this, right? And then infections, yes, infections can sometimes happen if you have a needle at a point where there was already infection, that it might affect some other areas also. So there are some of the risks. Contraindication is you cannot give acupuncture treatment to bleeding disorders, and especially if somebody is into the is taking anticoagulant drug. So if somebody is taking anticoagulant drug, then you have to be very cautious of giving acupuncture, because if we needle and there is a bleeding, then it might be difficult to stop the bleeding. So you have to be very, very cautious, and you have to take the history properly if you want to give an acupuncture treatment to a patient who is already having bleeding disorders or who is onto an anticoagulant drug. Even people having a pacemaker, contraindication is only if you are making an electric stimulation to a patient who is having a pacemaker. Otherwise, if you are not doing an electric stimulation, you can definitely give an acupuncture treatment. But if there is a pacemaker onto the patient, you have to avoid electric stimulation on the needles. And being pregnant is one of the contraindication of acupuncture treatment. That is into the first trimester. First trimester, we are not giving acupuncture treatment. Before that is prenatal, we are giving this acupuncture treatment before the pregnancy. And after the first trimester also, we can give some points to the pregnant females, just leaving her genital organs and the uterus and the uterus We are not touching the uterus points of the pregnant female, but if she is having back pain or something, we can definitely help her. So coming to the most interesting point of today is pain management points, because most of you here would definitely like to know what are the pain management acupuncture point. How can you relieve yourself, your loved ones with simple acupressure at home? So this is some set of the points that I'm going to show you today, which you can work with at your home and be pain-free. So let us talk about the analgesic points first. Whenever you go for an pain treatment, what would your physician give you? Definitely, he will give you some analgesic pills. So similarly, here you have analgesic point. You can have this analgesic point. You can make a pressure treatment at your home on this analgesic point and be pain-free. So the first point here on the screen is Li4 point. This Li4 point is a painkiller point for full body. So anywhere into the body, if you have pain, whether it is headache or if there is a pain into the eyes, if there is a pain into your stomach, you have pain in your shoulders, or you have pain in your back or leg, anywhere pain you have, this is a wonderful point, that is Li4 point. And the location of this point you can see on the screen also, right? So this is the Li4 point. This is my index finger and my thumb, and a web between this, you find this point, that is Li4 point. And very wonderful point, immediately reduces pain, even acute and chronic pain, both type of the pain, you can use this point, that is Li4. And also those who are looking for a glow onto your face, this is a distal point for face. So if you want to have a glowing skin, definitely pain and glowing skin, you can have glowing skin on the face, because it is only going to cater the face. So if you want to make your face beautiful also, definitely you can use this point, that is Li4. Location on the dorsum of the hand, between the first and second metacarpal bones, in the middle of the second metacarpal bone on the radial side, you will find this point, that is Li4 point. Highest point on the muscle bulge. So this is the muscle bulge. So highest point onto the muscle bulge, you will find this point, Li4. So you can do acupressure. You can do it with your fingers. You can do it with your thumb, or if you can even do it a matchstick if you are not having that probe. If you are not having that acupressure probe, the jimmy, you can make it with your own hands or matchstick, or even you can use your keys also, your vehicle key also, to give pressure. Only see that it doesn't hurt a lot. The second analgesic point is ST44. So it is into this, between the second and the third toes, proximal to the interdigital fold. जैसा आपने यहाँ पे देखा था ना, just you saw into the hand. Similarly, you have into the leg also. So this is, that's not that point. That's liver 3 I was talking about. That's not on the screen right now. In your screen, you are seeing the point, that is ST44, which is between the second and the third toe, proximal to the interdigital. So this is your second toe and the third toe. And in between this web, you will find this point, that is ST44. So ST44 and Li4 are the two painkiller points of your body. If anywhere you have pain into your body, you can use these painkiller points to immediately get relief of the pain at your home itself, right? So these are the two analgesic points. So let us talk about some tranquilizer point also, because when you are feeling pain, you even need tranquilizer point sometimes. Sometimes not only analgesic point will not work, you will have to add on tranquilizer point also with the analgesic point, with the painkiller point. This is DU20 point. Actually, it is called as a sea of 100 points. 100 diseases can be cured by this single point, and it is the best tranquilizer point of the body. How to find this? Put your thumb into your ears, and just where your middle finger touches here, that is the point DU20. So this is DU20 point, and this point, just make a pressure on this point. You will get very, very good. It's because it's cooling your mind and spirit. It's a tranquilizer point, And one more thing I would like to add about this point, because right now we are into the summer season. So if you are going out of your house and if there is so much of heat outside, you can just put green color. You can just paint this color green between your head only, right? So green color, if you put green color over here, you are not going to have a sunstroke. So even tell your children or your parents to do this. Whenever they go out into the summer season, they can take a green color sketch pen and just put color at this point, that is DU20 point. It will definitely help you into very, very good result. You don't get a sunstroke if you are putting a green color at this point. On the head, 5 chun directly above the midpoint. Now, what is chun? The width of the one thumb is the width of this thumb is 1 chun. So and the width of this forefinger is 3 chun. So let us go with 1 chun only right now. Width of this thumb. So 5 times if you go like that, that is the point DU20 if you want to measure it, right? Or other directly you can go like this and find this point, that is DU20, the best tranquilizer point of the body. Let us see 1 or 2 relaxation points also. So we already seen the analgesic point, we saw the tranquilizer point, and this is a set of relaxation point which is going to help you into any kind of pain. The first point over here is the pericardium 6 point. And this point is taken above the wrist crease between the tendon of palmar longus and flexor carpi radialis. So it is 2 chun is 3 finger and it is middle. So if you take your wrist and put your own 3 finger, it is in terms of the patient body. So if you are treating some or giving point to some child, put his 3 finger. It is into the patient body. So 2 chin is 3 finger and just center point. This point is pericardium 2 chun. So this is pericardium 6 point. So very, very helpful in any kind of pain. This is also going to help. Pericardium 6 point. 2 chun above the wrist crease between the tendon of palmaris longus and flexor carpal radialis. In tongue, you can easily locate this point, and it's also have an tranquilizer. Definitely it's a relaxing point, but it also tranquilizes and reduces pain. So it is midway between the medial end of the 2 eyebrow at the root of the nose. So this is the point, that is the yin tang. Basically Indian women put this kunku over here, the bindi over here. So that is the point, that is the yin tang, and it's a very, very good tranquilizer point, the relaxing point, the pain relieving point. So daily if you are giving a pressure at this point, you will feel very relaxed, you will feel tranquility, and you will be pain free. The next point over here is the heart 7 point. So at the wrist crease on the radial side of the flexor carpi ulnaris tendon between the ulna and the pisiform bone. So this is, you can find it, this is the little finger, and from this web of the little finger, if you go here down, then just here at the wrist crease, right? Once again, I will show you from this line, you make a line here and you come to this point on the wrist, and you will, your finger will fall on a dip. If you do like this, your finger will fall onto this dip, which is this point, heart 7. So the name of this point is also spirit gate. So it opens the gate of heavens and you feel like you are into the heaven. Very, very relaxing, right? So you can add this to your painkiller points. That is the heart 7 point at the wrist crease on the radial side of the flexor carpi ulnaris between the ulna and the pisiform bones. So these were some of the points that you can do yourself at home. And if you want a specialized treatment, you can definitely go to an acupuncturist. And if you want to learn and master this therapy, you can definitely contact Reshmi ma'am and we can work out something for all of you. The next point is extra 6 point. We already seen the DU20 point over here. So if you want more tranquility, more you want relaxation, then from this point DU20, if you go 1 thumb on all the 4 sides, 1 chun is 1 thumb. So 1 thumb on all the 4 sides, you have this point extra 6, which is also very, very good tranquilizer, relaxing point. ST36, you can see that it is 3 June distal to ST35 and 1 finger breadth lateral to the anterior crest of tibia. So if you see onto the screen, from this patella, the knee, this is the kneecap, the patella. If you go 3 June distal to this, you will find this point just near the tibia. That is the ST36 point. So these were the points that you can use for use at home to relieve all kind of pain, any kind of pain actually. And I wish all of you a pain-free life. So this was all about my presentation today. And I would like to thank the organizers, Rashmi ji, Krishnamurti ji, and my fellow speakers today. Thank you so much for joining, and all those who joined this session today. Thank you everyone so much.